Welcome to Revealing the Brain, an augmented reality experience. While wearing the headset, if you ever feel dizzy, nauseated, confused, or just want some help, take off the headset and notify a booth attendant. If you are having trouble hearing the voice within the HoloLens program, please inform a booth attendant who can help you adjust the volume. Each of the 5 modules will take you into an experience that depicts several pathologies of the brain. Use voice commands or air tap to navigate the program. Let's try it. Say next to continue.
Next.
Perfect. You can always use the voice commands next or done to continue or exit experiences. Now let's try the air tap gesture. Gaze at the Biogen sphere. Hold your hand straight out in front of you in an L shape. Now, tap your index finger down, then quickly raise it back up again. Great, you are now ready to begin. Please stand on one of the 5 starting points indicated on the floor. Please walk to a target to view a module. The toxic aggregation of certain proteins leads to an array of neurodegenerative diseases, including Alzheimer's disease, progressive supranuclear palsy, Parkinson's disease, and amyotrophic lateral sclerosis. Please select an option. In Alzheimer's disease, the formation of amyloid beta plaques along with tau tangles negatively affects neuronal activity and induces cell death. The formation of tau tangles is a pathological feature of progressive supranuclear palsy and may disrupt neuronal function and cause neuronal cell death. These tangles are also a pathological feature of Alzheimer's disease, along with amyloid beta plaques. In Parkinson's disease and other synucleinopathies, the aggregation of alpha-synuclein into Lewy bodies disrupts neuronal function and leads to neuronal cell death. Insufficient blood flow to the brain can result in ischemic stroke. In potentially viable tissue, inflammation or other factors can cause further cell death. Ischemia of a sizable area can lead to large hemispheric infarction and life-threatening brain edema. The blood-brain barrier may become more permeable in response to stress signals and inflammation. As it breaks down further, fluid may leak into the brain, which leads to cerebral edema. Hyperexcitable neurons can have detrimental consequences on consciousness and sensory perception. Please select an option. In epilepsy, abnormal synchronous or excessive firing of neurons leads to seizures. When injury occurs to the trigeminal nerve, it can become hyperexcitable, causing the patient to feel intense pain in response to innocuous stimuli or an unidentifiable trigger. In diseases such as spinal muscular atrophy and amyotrophic lateral sclerosis, damage or loss of motor neurons leads to progressive muscle atrophy and weakness. The damage or loss of motor neurons may lead to the atrophy of muscles used for mobility, sitting unassisted, head control, swallowing and speech, and respiration. Activated macrophages and microglia are directly associated with myelin damage in multiple sclerosis. Patients ultimately experience accumulating motor and sensory deficits, including cognitive and functional impairments. Demyelinated axons can be partially repaired in between relapses. However, this may become less successful over time and may lead to neuronal cell death.